So that story, South Africa has this week recorded, as we've been saying tonight, more than 20,000 daily infections for 4 days straight. It is the highest ever figures since the start of the pandemic. The country's level 3 lockdown restrictions are expected to last at least until the 15th of this month. That's next Friday. So will that be too soon then to lift restrictions on gatherings and the sale of alcohol, for example? Let's speak to Professor Mosa Moshabela. He's with the University of KwaZulu-Natal. He's joining us by Skype tonight. Prof, a very good evening to you. Grateful for your time. So these numbers that we've seen this week going between just above 20,000, even passing 21,000, is that all from the December rush?
Greetings, Tembekile and Faith. Yeah, I think that what we are seeing is an exponential growth of the second wave at this point. And we can pin it to activities from December, but remember that the activities that we are seeing on the pandemic curve are not only from the December social activities, but also started towards late November, when the second wave was triggered slightly earlier than we had anticipated. And also what we are noting is that the second wave is slightly different from the first wave, because sometimes people think that we've seen this before, but not quite, in the sense that the second wave is now kind of much bigger than the first wave. And it's also happening at a time when, there is people are fatigued and, the resources are strained. And we're also dealing with a mutated virus, which seems to transmit very quickly. So we are in a slightly unique situation than we saw in the first wave. But we can say that it's a combination of all these factors that are amounting to the rapid rise of infections we are seeing currently.
And with all those odds stacked against us, the very desperate question for most South Africans is, when are we likely to see a significant downward trend?
Yeah, and I think until we see that significant downward trend, we have to keep at the efforts to try and interrupt infections. We can say that, Eastern Cape looks like it's reached some kind of a peak, and also Western Cape is entering a peak. We are hoping that KZN will also show clear signs of a peak very soon in the next week or so. It's not guaranteed because the population size in KwaZulu-Natal is quite higher than Eastern Cape and Western Cape. What we can clearly see at the moment is that Gauteng is the one that's taking off in terms of exponential growth. And until we have a peak in Gauteng, I don't think that we are going to see a significant decline in infections in terms of the caseload and the epidemic curve that we're dealing with. My sense is that Gauteng is unlikely to peak in the next week. We can expect perhaps in the next 2 weeks for Gauteng to peak, and only then we can then begin to see a clear downward trend. We know that the second wave is going to be much higher than the peak for the second wave is going to be much higher than the first wave. And already at the moment is showing signs that it's almost twice as high. Mm-hmm. My fear and my concern is that it can get worse. I think people are thinking that it might not get worse, but we are seeing in the UK 60,000, 80,000 new infections, in a day, and they've got a population size similar to us. So it's possible that it can get worse. So we have to be mindful of that fact in terms of our predictions of when we might start seeing a significant decrease in the infections.
And I've just seen here tweets on the president's social media page that he's concluded a meeting with interfaith leaders. We know churches and the likes were among those affected late December with that announcement of level 3 lockdown restrictions. Brings me to this question: should those tighter regulations be kept well beyond the 15th of December, which is next Friday, 15th of January, I beg your pardon, which is next Friday?
Okay, so Tembekile, there's two things that I tend to focus on in terms of looking at the restrictions. One is, as most people are doing, is where is the pandemic or the caseload the worst? So where are the highest numbers? And also the second thing that I tend to look at is at what rate are the infections increasing? I think that at the moment we are sure, in my view, we are sure that the increasing infections in Gauteng are going to keep the curve of the pandemic increasing and growing for at least more than a week. And if that is the case, then we can then anticipate that by then we would not be seeing a decreasing trajectory of the epidemic curve. And if we are not seeing that decrease, then it is advisable to maintain the level 3 restrictions. And I should add that for a province like Gauteng, where the infections are growing at an exponential rate at the moment, level 3 restrictions are not enough. In fact, even though it's a good compromise between health and economy and society and the situation at the moment, my view is that as much as possible, those who can have to stay home, work from home as people go back to work, because then the more people stay home, the more likely we are to interrupt the transmission of chains of infections that is currently happening.
Another question that I want to throw at you, Prof, that perhaps you can put in context for us in a way that us laymen can understand. That's about how the Eastern Cape, for example, is still recording the highest number of deaths daily, right? But when you look at their active case count, KZN is miles ahead. Gauteng is also ahead. Some of the other provinces, in fact, like the Free State and Mpumalanga, that are closer to the Eastern Cape in infection rates, are nowhere near the level of death that we are seeing in Eastern Cape hospitals. How do you explain that?
Yeah. So the way you have to look at it is that the case numbers that we are seeing, we report them at the time when they are diagnosed. And in general, the natural cause of the disease is that a person who is likely to die from COVID-19, they will die maybe after a week or 2 weeks. And some people will go up to 4 weeks, depending whether they get to ICU and so forth, and the kind of health system support that they're able to get. But as a principle, and I hope this is not insensitive, is that we can say that deaths really occur. There's a lag period between the death and the diagnosis. So the people that are diagnosed today, we are going to see their outcomes, and this can be recovery, this can be continued admission, or this can be death. We are going to see their outcomes in a week or 2 weeks later, just because of the way the disease actually functions by natural progression.
And then a quick final one then, the issue of families we've seen in the Eastern Cape. I don't know if it's happening elsewhere in the country, where people are exhuming remains of loved ones who've died with COVID-19 because they say it's robbed them of an opportunity to perform certain rites, that these people are crying out from the afterlife, for example, that things were not done in the right way. Medically, why is it so important for us, if we are burying loved ones who've died of COVID-19, not to remove, for example, the plastic wrapping on the remains or the casket wherever it's put?
Look, at the moment we have an assumption based on what we have so far that infections can still occur, from the bodies of the departed and the deceased, which is why the precautions have been put in place, and we are trying to avoid that. But, Tembekile, I understand that we live in a difficult environment. There's tradition, there's culture that need to be respected. All of these factors make it difficult to cope with the pandemic. But the worst thing that is happening at the moment is the misinformation that is currently happening, where people are in denial of COVID-19. They are not disclosing COVID-19. And all of these things are contributing to people now having to ignore the precautions that have been put in place. And I also understand that there's also mistrust of government, and the regulations that we follow, they come from government. And because of that mistrust, people want to ignore what government is saying. But at the end of the day, we are a country that is harming itself. I understand the pain, the anger, the hurt that is happening because of the deaths at the moment. But we are harming ourselves if we are going to engage in practices that can continue to spread infections. We have to try as much as possible to negotiate with families not to do that, but also find a compromise where some of the rituals that families have to conduct in burials, they can do them without necessarily putting them at risk.
Professor Mosa Moshabela with the University of KwaZulu-Natal, grateful for your time tonight. Thank you.